Skin health is a top concern for all of us in a world where we get influenced by the so-called influencers and content creators, which sometimes leads to the wrong choice of products for our skin. Finding a right cosmetic provider is really a tough task. Ladies and gentlemen, today's podcast is all about finding a good cosmetic provider which tackles all these issues head on. We are very glad that we are having the conversation with a very talented Dr. Priyanka Malik Sachdeva, who is going to share the insights and expertise on skin health, on your beauty routine, and a lot of things. So let's deep dive into the conversation. So get ready to elevate your skin and your self-care journey with Priyanka Malik Sachdeva. How are you?
Hi, thank you so much for having me. I'm good. This is a really good platform, and I'm really glad I can share some insights with all of you.
Thank you so much for being with us. The very first thing, you might find it funny, but whenever you go to some events or somewhere and you see a lot of people or women especially, और उनका जो अलग तरीके का मेकअप करने का जो तरीका होता है, समटाइम्स आपको लगता है कि यार इसको ऐसे नहीं करना चाहिए, ये बहुत केकी है, ये बहुत अजीब है. You feel like this?
So, with social media's expansion and people having to take care of themselves so well now, the self-care has improved. So people want to look good. Everybody wants to look good, but they don't know how to do it. And the best way to do it is when you can naturally preserve your skin and showcase your own skin. But most people don't do that. Sadly, they like to conceal themselves. So what you're talking about, like when people do a lot of cakey makeup, yes, it's actually a little sad because they're trying to conceal all their flaws. But there are better ways to do it, and cosmetology is the way that you actually can help improve your flaws and look the best version of yourself. You don't need that cakey makeup at all.
And I think people do this because they actually don't know their skin type.
Absolutely.
वो तो basically अपना खुद का skin type जानने के लिए what one can do.
So of course, social media or Google Baba will not help you here. Yes. You have to visit your doctor. So please visit your dermatologist or cosmetologist. Your doctors will be the best people to do an assessment, to understand your skin type, and to tell you what product suits you best and what products should not be used. So a proper prescription of a proper skincare will only be advised by your doctor. No self-prescriptions at all.
Okay. There are a lot of myths and a lot of other things that people see कि हाँ अगर हम ये करेंगे, like if we go for chemical peeling or hydra facials, still there are people who don't want to accept it wholly. Like उन्हें बहुत सारे risk लगते हैं.
So cosmetology as a branch is a widely researched and it's been researched for years. There's massive studies being done. There are a lot of researches being done. It's not something which is new, nascent. There is no experimentation, nothing of that sort. Which people think हमारे skin पे experiment किया जा रहा है, ऐसा कभी भी नहीं होता है. So this is backed with a lot of knowledge, with scientific data. So only when the scientific data is relevant is when something is approved by a medical authority like a Food and Drug Administration. So the highest authority in the world is US FDA, which is US Food and Drug Administration. So most of the countries have their own authorities. Once a certain procedure comes into practice, there is an authority figure which approves these procedures, and only then they can come into practice. So nothing among these procedures are actually experiments as people think. These are widely researched, backed with a lot of scientific data, and only then they come into practice. So a lot of these treatments that we're doing, say from chemical peels to hydra, etc., all of them have been in practice for almost a few decades. It's not just very recent. Yes, of course, there are a lot of new things which keep coming. It's a very, very, it's a widely booming industry, and it's always, there's something which is always, there's a lot which is going on. There's lot of new trends which keep coming. So this industry is constantly growing, but no experiments here. And yes, of course, we get a lot of apprehension with the safety protocol, and that's one of the first things, in fact, that whenever somebody comes to us,
Because
the
they are
first
coming for their skin health.
absolutely. So the first concern is always kuch kharab to nahi ho jayega.
Yes.
I hope it doesn't get worse than it already is. The whole idea of doing these procedures is to get you feel better and not worse. You know, as a doctor and as a clinician, of course, we would not like to worsen something. The whole idea is to do it in a under safety protocols. So if that's not done, we're not doing what we're supposed to do. You know, this is what we're set out to do.
Yes, that's true. But you know, Abhi, recently, or it's very common. Like people come, and you as a physician or cosmetologist can't guarantee, like कि आपका skin ठीक हो ही जाएगा. And sometimes it might get backfire. तो उस चीज से कैसे फिर आप deal करते हो?
That's a very good question. So, aesthetic medicine is actually a very difficult, field, because when somebody comes in, firstly to make up their mind and to reach a clinic takes a lot of effort, I understand. But once they are there, they think it's magic. They think just because, there is some amount of money which goes on in these expensive procedures, no denying that. But once they come in, they expect कि अब ये जादूगर बैठी हैं और हम कुछ बहुत, some transformation is going to happen. And sometimes it does happen. Actually, there's sometimes which we get, we ourselves surprise, we surprise ourselves, we get some really good results. But the one thing that, all of us swear by in this industry is that we always under promise and over deliver. So that's the only way we get around it, because even if I look at your skin and I tell you that, okay, I know there's 1, 2, 3 things which I need to correct, body types differ, skin types differ. There are times that certain things don't respond as per,
Their diet schedule, everything.
lot of things. There are a lot of factors which play a role. It's not just the treatment plan. There are a lot of times that there are a lot of underlying factors, like you said, diet, lifestyle, sleep patterns, mental health levels. A lot of things which play a role when it comes to your skin health. It's not just, one shoe fits all. So it is tricky sometimes. So, which is why when a client or patient comes to us, our first consultations is the most important one. So we take a good 40-45 minutes for one consultation to understand the mindset of the person, to understand the need of the person, to understand the budget the person has. So we devise a whole plan. We have a personalized plan ready for the client, and we don't just say, okay, हमारे पास ये 1, 2, 3, 4 चीजें हैं, let's try 1, 2, 3, 4. It doesn't work like that. There is an assessment. There are times that, we tell them that it's going to be a lot of modalities put together. It's not just that we'll try as per, set protocols. Maybe this works. There are times that there are some resistant cases where we don't get very good results. So, but we, make sure that we're on the same page before we start. We tell them that, this is what we're doing.
That's actually safe for both of the parties.
Absolutely,
Yes.
absolutely. So this is what we're doing, but there are times that you might not respond very well. So if we're not going to get very good results, we might need to switch to modality 2 or 3. So mental preparation is very important for the patient. Secondly, when we're talking to a client, we also understand the expectations of the client. So a lot of times in this field, people have very unrealistic expectations. Like I said, they expect
I can understand. I can relate to that. Yes.
They come to us and say, "अच्छा, हमने तो पैसे दे दिए, आपको तो ये जादू करके देना था," but it doesn't work like that. So we set very realistic goals with them, and we tell them that, okay, this is what we're going to deliver, and mostly we know it's going to be better than that, but we don't tell them. Okay, because if we tell them, they'll have the expectations there. So if the expectations are right here and they see that result, they come back really happy. So that's how it works.
So in case if the risk happens, how you deal with it? Like जैसे उन्हें लगता है कि हाँ, now the magic will happen, and थोड़ा बहुत भी उससे कुछ थोड़ा सा कम होता है, तो they might feel कि यार क्या हो गया, तो थोड़ा अलग तरीके से deal करते होंगे. So how you deal with it?
So, see, this happens. See, in any field for that matter, like I said, it varies from person to person, body type to body type. So, sometimes there are, risk factors or the things that do sometimes go wrong. or there are downsides, or maybe the downtime is increased, or there are certain like थोड़े burns हो जाते हैं या pigmentation हो जाता है, which is unexpected. It delays the whole process, which is unfortunate. But of course, being a doctor, you know how to deal with it. There are some emergency protocols that we do follow, and
Also, the
you know,
practice matters.
absolutely. So I have a very good team of people. So we all work very closely. So any, from the smallest issues, we're all addressed at right at that time. But I understand that there are times that I can't take care of every single patient at every single time. So at any time, it's brought to my notice, and we look at it almost with immediate effect, so that the client is happy and the patient is happy, and the downsides are not very apparent.
So when we're talking about this, before we move to the next part, I just want to note that micropigmentation, glass glow skin, skin brightening, and there are a lot of like peeling, hydrofacial. In सब के बाद, what is the basic routine you prefer giving your clients or the patients?
So these are very varying procedures that we're discussing. Every procedure will have a set protocol of skincare which needs to be followed. So basic is a CTMP, which we follow, which is the
What is
cleansing,
CTMP?
toning. So cleansing, toning, moisturizing, and sunscreen.
Okay.
So this photo, protection. These are the basic skincare routine that we follow, and which everybody, be it a guy or a girl, everybody needs to follow. Again, there is a very set concept कि ये तो सिर्फ लड़कियों की चीजें होती है. Happily enough, now the concepts are changing. Men are getting really aware about their skin, and they're really taking care of their skin, which is very good. We have about, when I started off, my practice was, I think, 90-10, 90% women and 10% men. But now it's happily, I think it's 65-35. So I'm very happy that men are also taking care of their skin. They're very excited, and they're getting good results. Having said that, so a basic skincare routine is important, basic CTMP, but again, it varies from the age to the need of the patient to the underlying conditions. So if it's, say, it depends on the skin type. So if it's a sensitive skin, we treat it accordingly. If it's an oilier skin, or if it's an acne prone skin, or if there's pigmentation or a dry dullness, if there's aging. So we prescribe certain active ingredients accordingly. So those active ingredients come in the form of serums, in the form of essence, in the form of masks, etc. So those need to be added on according to the need of the patient, the age of the patient, underlying conditions, etc.
Okay. So let's talk about the Botox, under eyes, and chin uplifting, and all of that. There are a lot of procedures.
Right.
I too even don't know them, but so how people are accepting all these things? Like, are they
Getting it right,
accepting?
don't worry.
Okay.
So, see, when it comes to facial aesthetics, that's my domain. So, when I started off, and especially in Agra, the awareness was not much. So, people weren't aware. They had heard about these procedures, but it sounded very scary.
Exactly. Like I have some of my friends who just want to take these treatments, but they are so scared. नहीं नहीं उसके बाद ऐसे तो नहीं हो जाएगा. नहीं नहीं ये no, this is not safe.
Right.
So वो बहुत सारा discuss करने के बाद they come to a point again where they have started.
Right.
Like, so how people are accepting it?
So, see, when there's it's a very common known fact that whenever there's less knowledge about something is where myths happen.
Yeah, okay.
Right?
Yeah.
So when you don't know much about something is where people start, sharing their insights and say, nahi nahi, isse ho jata hai, isse wo ho jata hai. That's
But
because they're not educated
yeah,
enough about the particular, process.
They know a lot of things by Google Baba.
Exactly. And Google Baba is not the ultimate. So sadly, see, there is all kinds of information on Google also. There can be good information and bad information.
Yeah.
Now, as a layman, you will not understand what's right and wrong for you.
Yeah, true.
So you can read 100 things which might be, right, wrong, and you don't know how to differentiate. So that's where we come into the picture. So earlier, when I started my practice in Agra, there was a lot of apprehension. So I have gone and done demonstrations in kitty parties and clubs, and just to get them aware and to show them the correct picture, and to show them a live demonstration of people being absolutely okay right after the procedure also. So that was done long time back. Now, cut to like 7-8 years of my practice, I have people walking and saying, Doc, I need crow's feet, Doc, I need Botox, I need a facelift. So we've reached that stage now, which has been a lot of effort, it's been a lot of consistency. And now the apprehension is slowly going down. We try and educate our clients as much as possible. So one, education never goes waste. So educating one person, even if that person doesn't come back to you and gets Botox done, he'll probably even remember that and go and tell two more people that, you know what, Botox is safe. It's not an unsafe procedure.
This mouth marketing
Absolutely.
works
So
a
word
lot.
of mouth marketing is our best marketing, and that's all we need to do is just educate our clients. So there are a lot of people who probably immediately won't get it done, but it'll somewhere stay. It'll stay somewhere in the head, and they probably come back to us like a year later and say, "Okay, doc, I have a wedding coming up. Can we do something about this?" So that's how it works, and I think education is the only way that all the myths can be, completely worn away with. So yeah.
So you talk about our wedding is coming. So there are people who talk about this कि एकदम शादी से पहले if you are having your wedding on certain date, उसके 15 दिन पहले, एक महीने पहले से आपको करवाना चाहिए, otherwise it might get backfire और फिर वहाँ main day में problem हो जाती है. Is it something like that?
So see, again, we have we have a certain routine of things we follow for pre-bridal and pre-groom packages. We ideally advise like brides who coming to us, and a lot of brides we take care of. So 1 year prior is when we start.
Okay.
Yeah, 1 year
So this is
prior.
the ideal time of
Ideal time to
yeah.
start. So there's certain procedures you start 1 year prior, like your laser hair reduction, because that takes time. That's a permanent hair reduction procedure, but it's a lengthy process. So you start that about 12 months prior. Then about 9 months prior, you get down to your peeling and taking care of your scars or texture improvement, etc. 6 months prior, again, we take care of, if there, again, any body polishing or anything that needs to be taken care of. Then we get down to rejuvenation procedures. When it comes to invasive procedures, anything invasive like, resurfacing, etc., that we do earlier. But Botox fillers, we ideally try to schedule it not just before the wedding, but ideally maybe like a month or two prior. Botox is done more closer. So if we have time in hand, we normally try to get 2 shots of Botox done. So we do like 1 shot, maybe like 6-7 months prior. So they've had an experience of Botox, they know how it is, they're not apprehensive about it. And then we do one right before the wedding, because that's a one-time treatment and the results they last for about a good 4 to 6 months. But with fillers, so a lot of girls come in, for under eye nowadays, social media, like, your phone usage and everything, and bad sleep routines. So a lot of girls have under eye volume loss. So that, the fillers that we do for that, or like a facelift or whatever, that we do ideally at least 1.5 months prior. The best results taken that much time to give, to set in. So that is the ideal time frame that we follow.
Okay. So these procedures you're talking about, are they permanent?
There is
Or-
nothing permanent.
No. Are they permanent? As in, if the person is taking care of, like, अगर Botox करवाया, and if she is taking care of, so it is permanent. Otherwise, वो कितने time तक it will last?
So, Sakshi, your body is aging, right? So today you're say a 25-year-old, tomorrow you will be a 26-year-old. So as and when the body keeps aging, there's going to be changes in the body. Similarly with the skin, there's nothing which is permanent. These are semi-permanent procedures. Why we call them semi-permanent is because they're delaying aging to a certain extent. Now, aging does not only mean a 50 or 60-year-old as per, people's concepts. Anytime there is a need of the skin or need of the face, suppose a certain particular indication is bothering you, is when you can get it addressed. So anything after 25 is when you can get these non-surgical procedures done, like a filler or a Botox. We don't normally try and inject under 25. But a Botox would last for about 4 to 6 months. A filler would last for about 1.5 years, maybe even 2 years, depending on which filler is being done and which area is being done. Like a lip filler would last for about a year. A facelift
उसके
filler.
बाद it gets back to the original shape.
So it's not like 1 year and cut over.
Okay.
It's
धीरे-धीरे,
वो,
yeah.
as and when you're aging and it starts breaking down. So these are basically, these are sturdy molecules of hyaluronic acid, which when it goes into your skin, it becomes a part of your skin, and it hydrates. So you'll see it volumizing, you'll see your skin hydrating and lifting. All those changes are going to happen. But as and when the, with aging and with changes in the body, etc., so it'll slowly start diminishing. Um, there have been results even better than 2 years. Like I injected an under eye filler for my husband. It lasted for about 3, 4 years. So it completely depends on your lifestyle, your stress patterns, your sleep patterns, a lot of things. It's not like you can really maintain it, but again, sometimes it varies from person to person. So most people, like after a certain age, need it more regularly, and but the earlier you start, the better longevity you have.
Okay, so you mean to say that these all procedures are semi-permanent, but if you take care of your skin, it will long last than expected.
Not necessarily take care of your skin, but there are a lot of factors which
Like
actually
sleep schedule
contribute.
and all of
Yes,
that,
yes, yes.
like they can long last, but
They
right?
can, they might,
Yeah.
yes, they might last a little longer than that also. But again, again, it's completely subjective. Yeah.
Yeah, okay. So, in short, just tell me what are the basic misconceptions people have about Botox and fillers?
So one of the major misconceptions is कि हमें cancer हो जाएगा.
Okay, okay.
People think extreme. They don't think,
This is new to me
yeah,
as
no,
well.
no, not at all. It's one of the most common myths, and we go like, yeah, okay, never mind. So, yeah, so, social media and, online researches are so vast that people read anything and everything. Like, we just, yeah,
People's
minds without even having to understand what's right and wrong. So cancer, then people die because of Botox and fillers. So it's very extreme. So we have to deal with a lot of myths. So we have to like get them from there to like listen. Nothing happens. It's a very basic procedure. So these again, like I was mentioning earlier, these are all US FDA approved procedures. Every molecule going into your body is safe. Like as a doctor, we take absolute precautions. We have all safety protocols in place before doing that. And the training for these procedures is very meticulous. So, not every doctor is actually given the training. People who are given the training have to undergo like a whole rigorous, procedure of getting to train with these, these molecules. And once we've received that kind of training, is when we get the certification. When we've done a certain number of clients and everything, is when we get the certification. So it's not easy for everyone to pick up a Botox or a filler. But once it comes into practice, is when the companies actually, it's not like आप market में जाओ आपको botox खरीदने को मिलेगा or something, so it's only certain number of doctors in the country who are actually injecting. So it's all about the skill and expertise. It's about your knowledge. So if someone is practicing botox and fillers, the only thing you've got to see is the expertise of the doctor, to see the experience. And yeah, that's it. And probably previous cases and everything. That's all.
That's where I was coming. What are the basic things a person should see when they are just they just want to see a aesthetic physician or a cosmetologist? What are the basic things they should see in a doctor?
So, see, when it comes to aesthetic practice, there are a lot of people practicing in. Sadly, there are no guidelines when it comes to the aesthetic practice. So, there are beauticians also who have opened cosmetic practices.
And
There are doctors.
they just coming from parlors and all of that, and they're like, I
yes,
will
yes,
do
absolutely.
it.
And this is worldwide. This is not just in India. This is worldwide. In fact, India में तो सबसे कम है. In outside, every single salon is doing Botox and fillers, which is actually illegal. So the only thing you need to check is one, if the experience of the your doctor. Um, Google reviews is not the ultimate, because nowadays Google reviews are bought, and it can be really misleading. There are people who are lashing out on online and everything. But you just get a fair idea of how the doctor is. But the best way to actually understand how legitimate this doctor is, or how legitimate the practice is through word of mouth. When you get a good feedback from somebody who's already taken services, is when you can actually understand the practice of the doctor. So that's actually our best feedback. Like, we do marketing, of course, but then our best feedback and our best marketing is our own clients. So it's just that I think if you hear it from somebody, and if someone has already received a particular service and they've got good things to say, that's your person to go to.
Uh, I have heard lot about it. Korean glass glow skin. Like बहुत सारे अगर कोई फेशियल करवाने जा रहे हैं, they're like ये मत करवा, तू वो करवा ले, ग्लास ग्लो करवा ले, उससे स्किन ऐसे शाइन मार जाती है, एकदम ग्लो कर जाएगी. सो व्हाट इज दिस?
So, Korean glass skin was initiated by Korean beauty influencers. So, the whole idea is to have flawless skin. So, there was, again, see, trends keep coming and going. There were times that people were embracing having hair all over the body. Uh, there are different things which keep coming into the market. So, Korean glass skin is basically skin which is as smooth as glass. So basically, it's like a
So is it for
mirror
real?
reflection.
Yeah, it's
Some
just
kind
people
of
talk
that.
about it and
So
it's just this.
these beauty influencers actually went so viral that the concept gained so much popularity. It's actually Korean glass skin is basically just a 10 step skincare routine.
Okay.
It's a skincare routine.
It's not a
No,
procedure,
no,
nothing.
no. It's not a
Okay.
procedure. It's actually a skincare routine, which is
This is surprising for me
yes,
as well.
yes. It's actually just a skincare routine, which is a 10-step procedure. It's a gentle cleansing, then it's a double cleansing, then it's an exfoliation, then there's toning, there's essence, there's serums, there's sheet mask, then there's moisturization, sunscreen, etc. So eye cream, etc. So this is actually the whole procedure of what Korean glass skin should be. But having said that, there are also some procedures which add up to it. Like the term is what everyone's been monetizing on because it gained so much popularity.
Yeah.
So now,
And it looks सुनने में भी ऐसा लगता है, oh, what is this? It
so
seems really good.
it's just something which has been adapted without even having to understand what it is. It's adapted all over the world and it's gained so much popularity that now if you the minute you use Korean glass skin without understanding उसमें क्या है, people go like हाँ ये ठीक है, because sometimes there are certain terms which just stick. So with social media influencers, the way it went viral, so now clinics and a lot of doctors have started using those terms for our benefit. So now we've used that and we do procedures which will enhance those results. So there are multiple things that you can also do to enhance those. You have so we have these hydration injections. That also adds to the Korean glass skin. We have microneedling radio frequency treatments. That also adds to it. Basic exfoliations. There are hydrofacials. So a lot of procedures or treatments also which contribute to getting that glass skin.
So as a cosmetologist, you suggest people this Korean glass skin?
So we're
Or
all
you-
working towards that. But whenever a client comes to us and says, "मुझे वो glass skin चाहिए," we get a very realistic picture into the client's mind also that listen, that is a very good concept, but please understand your skin type and let's not compare with influencers and everything. So giving them a realistic picture of what can be expected is more important than just having to attain something which is available on social media.
So is there any alternative you suggest your clients कि अगर like इसमें इतना है रिस्क है या कुछ भी है या आप जितना आप देख के आए हो सोशल मीडिया पे उतना नहीं मिलेगा, एक्सपेक्टेशंस पे मत रखो उतनी, तो इज देयर एनी ऑल्टरनेटिव जो आप कोरियन ग्लास ग्लो के ऑल्टरनेटिव में किसी को सजेस्ट करते हो?
So we do glutathione treatments. See, when you're talking about the glow and we're talking about skin brightening, so skin brightening treatments, there are multiple. In fact, it's a very, very it's a very upcoming field. Like the skin brightening and IV glutathione is something which is gaining massive popularity. So glutathione is basically a molecule which is metabolized by your liver. One of the side effects is skin brightening.
I have heard this term glutathione. Yeah, and उसका मैंने जस्ट बाद ये भी सुना कि इससे ब्लड थिकनिंग हो जाती है, लिवर खराब हो जाता है.
So liver का आपने जो mention किया, that's actually right. So with glutathione, the only precaution that needs to be taken is the dosage. Again, sadly enough, glutathione is very easily available online, and people have started self-prescribing glutathione to look fairer. Now, see, the fair industry and the color industry in our country is varied, and it's a very it's just a very wrong concept. I think we as a cosmetologist, we never talk about color.
It's a clear skin,
Yes,
flawless
we talk
skin.
about brightness, we talk about getting a flawless skin, but we don't talk about color. Color is a very wrong concept. We're all born with beautiful colors, and embracing that, enhancing that is what our job is. but changing that is not our job. And we don't, we don't intend to. And I get a lot of requests, I get a lot of patients come to me and say, मेरा color change कर दो, मुझे गोरा बना दो. गोरा नहीं बना सकते. And ये हम expectation रखते भी नहीं है client से कि ऐसा कुछ हो सकता है. And a lot of people, like from mothers telling their daughters, husbands telling their wives, it's a very sad concept, but color is something we're all obsessed with. So differentiating that we're not changing colors, we're just brightening your skin, is where IV glutathione comes into the picture. It's a beautiful molecule, but if used in the right dosage and under right indications. So जैसे आपने अभी बोला, liver का there are issues with the liver. So if taken in a very high dosage, be it IV or oral, it can cause changes in the liver. So we don't advise beyond a certain dosage. And the frequency also matters. So glutathione should actually never be self-prescribed. It should be only taken under clinical guidance, in a clinical setup, and only be prescribed by your doctor. So if your doctor is not prescribing an oral medication, please don't take it. And again, sadly, it's available very easily online, and people are popping pills like, it's candy. But it shouldn't be done. And also, it's contraindicated for a certain number of people, like people on psychiatric drugs or chemotherapy, or people who have kidney or liver issues should never be taking these medicines. So yeah, these things people are not aware about. So that's where we come into the picture.
So does client come to you or patients who already took the glutathione tablets or capsules, and they later comes them हमारे साथ ये problem हो गया.
Absolutely. So again, जो easily available online है ना, उनको लगता है since there's accessibility to it. Sadly, there's nobody to guide. So or no offense to beauty influencers, but there are times that beauty influencers are also promoting or propagating these without understanding the side effects of it. So yes, there are a lot of clients who come to us and say, I've been eating glutathione since years, and my first question is always, has it been prescribed or has it been self-prescribed? So once you understand the mindset of the client, you'll understand that, where is this coming from, and then you need to really counsel them more than anything to make them understand that, let's get whitening out of the mind, because this is something which can go on. It's like an umbrella effect. See, glutathione is a molecule. जब तक आप खा रहे हो बहुत अच्छा रिजल्ट आएगा. Umbrella पकड़ा है, बारिश से बचाता रहेगा. जैसे ही umbrella हटाओगे, आप भीग जाओगे. So something like that. As long as you're taking the medication, it's going to give you beautiful effects. It will reverse back to a certain extent. It will not go back or get worse than what it is.
It can affect your health.
It won't affect your health till the time you're taking it in a certain dosage.
Okay.
But
if you are taking it without prescription,
yes, absolutely. See, without prescription का problem ये है कि आपको underlying नहीं पता. अगर कोई underlying condition है and it's contraindicating with a particular drug, it could cause side effects. Or if you're taking more than the prescribed dose, it can cause side effects. So just carefully take these medicines. It's not something that you can just pop as candy. Yeah.
True, absolutely. You just when we're talking, you're like, there are influencers and content creators who actually promote like anything, because they are getting paid for it or they get view for it. So how people can differentiate, like, this is good, this is not good, we can take it or we cannot take it. So what is the right approach to it?
See, I have a lot of beauty influencer friends also, so I love you all, but nothing against anybody. But I feel when you're on social media, it comes with a lot of responsibility. And since you're influencing, you've got to be very careful and responsible about the kind of information you share out. So the good thing, see, it has pros and cons. The good thing about beauty influencers is that they have increased the awareness, they've increased self-care. Women have started taking care of themselves like they never did before, which is amazing. Like it's something which is really commendable, and that's all because of the beauty influencers, because they show them it's possible. Sitting at home, you can take care of yourself and look good and be presentable. Their self-worth increase, their self-esteem increase. Amazing, change in the whole, general generation as such. But because it's such a volatile industry and there's so much happening, there's so many new trends coming and going, etc. So somewhere, you know, as beauty influencers, you've got to kind of draw a line between sharing information. You know, there are times that, and these are actual studies where it has actually also taken a hit on people's mental health because of so much of availability of information. Also, there is so much of dissatisfaction and self-esteem issues in people because they feel like that one looks that good, you know, I have to beat that or I have to make it to looking, you know, I don't look as good. So it actually takes a massive
They just eye on them like
yes,
anything.
and a lot of times because of these self-esteem issues, body image issues आ जाते हैं. Body image issues में आप कोई भी हद तक जा सकते हो to change that about yourself, and that is a problem. That is a serious psychological problem, and that's something which needs to be addressed. So again, you know, sharing information, like I have actually called out to one or two influencers on social media and said, listen, when it comes to popping pills or, you know, even your skincare routine, it might be working really well for you, but a random layman might think ऐसे करके बहुत अच्छा हो जाएगा, and it might be spoiling their bodies, you know. So just be responsible when you're talking about popping pills also, for example. You know, don't just so casually share information like you should have this supplement or you should try this supplement. No, you
I am having this issue and I started taking it and now
but
I am
you
all
know,
good.
it's body type to body type varies, your skin type to skin type varies. Everybody has a different need. It's not one shoe fits all. So if somebody is looking good, and I get this, a lot of clients come to me and says, पर उस ब्यूटी इन्फ्लुएंसर ने तो ये लगाया, उसका तो स्किन इतना अच्छा हो गया, मेरा क्यों नहीं हुआ? So I'm like, so you have to start right from scratch and tell them, listen, your skin type is completely different. You don't want to look like that person. You don't know what that person is doing behind the screen.
Yeah, exactly. Sometimes
So,
they show something on screen and they're using something else on.
Absolutely.
On
See, they're being paid for it, and
Yeah,
no
of
offense,
course.
that's their job. But that doesn't mean they're sharing all information with you. Maybe they're not. Maybe they're getting, you know, 10 other things, or maybe they have, you know, a different skin type altogether for that matter.
Exactly.
So just because somebody is doing something is not, and so that's why it comes to a lot of responsibility. And our job is to, you know, educate our clients and tell them that please don't look at that as your goal. This is what you have, and this is what we're going to address, and this is what we can achieve. Let's just focus on this and not focus on achieving or trying to be XYZ. So a realistic picture is very important, but yes, I feel beauty influencers should just be a little responsible when they're sharing information. That's
So this is the difference when you go to a cosmetologist. They educate you, and the beauty influencers, they influence you, and this is really a big difference. And okay, so moving ahead, like there's another aspect, procedure for laser hair reduction. What is it, and how long lasting it is?
right. So laser hair reduction is one of our best-selling procedures. It's a permanent hair reduction procedure. We don't call it a removal, we call it a reduction because it's not 100%. No laser would give you 100%. It's as close to 100%, but it won't give you exactly 100%. So it does two things. It reduces your density and it reduces your changes your coarse hair into finer hair. Now, most of the hair that we have on our body, it's unwanted. Except for like your nostril hair or, you know, the hair in your ears or your eyebrows, etc. So these are essential hair. Rest of it all comes under non-essential hair. So this non-essential hair, it is aesthetically unpleasing. So there's no other way to get rid of it permanently but laser. Waxing, say, is a regular procedure, so you have to keep getting it done every month. But laser is the only way you can get rid of hair permanently. But it is a lengthy process. It takes time. Again, it varies from person to person. There are some conditions like PCOD, PCOS, hirsutism, where it can take a little longer. But an ideal would be about 6 to 8 sessions, and that goes for about a year. So eventually, your time frame, your longevity will keep increasing. Like window period between 2 sessions, it'll keep slowing down. Your growth cycle will keep slowing down, and it's permanent. The one myth that we always hear is the minute when somebody comes to us is a laser, तो इससे तो cancer हो जाएगा, radiation है,
cancer हो जाएगा.
cancer तो favorite है. So So just to explain it to you medically, so there are two kinds of radiation. One is ionizing and second is non-ionizing radiation. So ionizing radiation is basically the ones which you see in X-rays and MRIs, etc. So those radiations always cause some bodily changes. So whenever you're exposed to X-rays, आपको हमेशा बोला जाएगा एक स्क्रीन के सामने खड़े रहना, etc. So there's always going to be minute changes in your body. It's not very apparent.
Changes as in
Yeah, your
what
molecules, there'll be some bodily changes and the molecules will change to a certain extent. There'll be changes because of the radiations. But with laser, these are non-ionizing radiation, जिसका मतलब है कि body में कोई भी तरीके के at a molecular level there will be no changes. It's just heat. गर्मी से वो बाल आपका जला देंगे बस. So as many sessions as you take, it's absolutely safe. There are no changes in the body, so you can take it for a lifetime also.
Okay, so once the procedure is done and the hair reduction process has been done, so how long lasting it is?
It's permanent.
It's for life.
Yes, it's permanent.
Oh,
So,
okay.
there are no changes, so it does not come back until and unless your body goes through severe hormonal changes. There might be some growth, but that's also very minuscule, and so only on hormone dependent areas. So there's certain hormone dependent areas in the body, like say the chin area or even like the midline. So those areas you might start seeing some growth if there are severe hormonal changes in the body, like if you're going through a pregnancy or if there is menopause, etc. There would be some changes, so there might be some growth, but your major
And that's
majority
minor.
of hair are taken care of, so it's not
Okay, okay. So the next part is because we are so tensed, this era is taking lot from us, and there's a permanent hair fall problem with, I guess, everyone around us. So what are the basic treatment you give or people comes to you, and what you suggest in that case, and this hair fall treatment?
Yeah.
So again, people are accepting it, and वो कितना कैसे आप करते हो उसको?
So see, hair fall पहले समझने के लिए हम पहले एक history लेते हैं. So understanding a medical history.
Okay.
So to understand a medical history is very important to know the root cause of the hair fall. So from your diet, lifestyle to your underlying conditions like maybe thyroid, sugar, vitamin D, B12 deficiencies, there could be a array of things which are responsible for your hair fall. So normally we start with a blood workup, and we do a proper assessment we understand, we sit and just have a proper discussion with the client. So we understand the whole, we understand the whole picture. We get a blood workup done. Once we have the test in hand, we can narrow it down to the actual probable causes. So with men, it's mostly genetic, and with women, I'm generalizing this now, but it's also a lot of stress related or underlying metabolic issue related hair fall. So also, there are times that if the body's undergone a certain shock, like say you've fallen sick, 3 months later there will be a severe phase of hair fall, okay, which is normally a self-correcting anomaly that corrects in about 4 to 6 weeks. So that's something we don't get worried and we don't do anything invasive. We just put them on, say, certain supplements and they're good to go. But if it's a prolonged hair fall where it's gone beyond like 6 weeks or 8 weeks and it isn't correcting on its own, is where we step in. So there are multiple treatments that we adopt for this. We do PRP treatments. So all mesotherapy treatments, we do microneedling, we do PRP, we do GFC, something we've recently...
Please elaborate this PRP, because we don't understand this terminology. Yeah.
So platelet-rich plasma is PRP. It's one of the most basic and most natural treatments that you can get done for hair. So basically आपका blood withdraw करेंगे, उसी को हम machine में process करते हैं in certain specialized tubes. So उसमें आपका जो plasma है वो अलग हो जाता है. वो plasma has got some growth factors and activated platelets. So they, when used back into your scalp, gives benefits. It boosts your growth. It improves your hair fall. आपका thickness of the follicle बढ़ा देगा. So overall density will get better. This takes about 3 to 6 sessions. Again, it depends from person to person. So that's when assessment is important to see the underlying condition, etc. उसके बाद हम decide करते हैं कितने sessions are required. So if it's just like a hair fall issue, Normally 3 sessions is also, sufficient. But then if it's alopecia, which is a genetic condition, it can take up to 6 sessions also. And we don't obviously promise 100% results, but it does show very good visible results. And you can also take up to 9 sessions. It depends from person to person. Apart from that, we also do GFC, which is also similar. The whole process is very similar. And इससे natural कुछ हो ही नहीं सकता, आपका ही blood है. So we're not adding anything artificial in this. There are some new treatments which are gaining popularity, which we'll be introducing very soon. One is exosomes and second is QR678. These are processes where the procedure is the same, but these are specialized mesotherapy cocktails, which are again introduced back into the scalp, and they give some beautiful results. So again, about 3 or 6 sessions, and you can see some fantastic results with the hair. So again, like Agra being a belt where there's so much hard water,
Yes.
the dryness is so much, and the hair follicles are normally, there's a lot of hair fall which is happening. So the first consultation is my most important, interaction with the client. A lot of times, like, people are, there are also wrong habits. Like, people are washing their hair every day. Or I had a client recently who said, मैंने 6 महीने से hair wash नहीं किया है.
What?
Yes. So
6 months?
6 months. And there are crazy people. There are a lot of
And they're still having
yeah,
hair?
yeah. He said, okay, I was having so much hair fall. अगर मेरे को लगा मैं wash करूँगा तो कुछ problem हो जाएगा. I hope he's not saying this, but yeah.
6 महीने
6 महीने
उन्होंने wash नहीं किया,
So
उसके
you-
बाद ही बाल बचे उनके सिर
बचे हुए, and he thought he saved it because he's not washed his
पे?
hair.
That's crazy.
That is. So you get such varying cases. So you, again, to understand the whole history is very important, and to pinpoint exactly where they're going wrong. So a lot of times it's also their own habits. So understanding those habits and what they're using, what they're not using, and nowadays the pattern that we've been seeing has a lot to do with the lifestyle. So diets are very, very screwed up. Lifestyles are very bad, and these are direct contributing factors. Like, and when I start giving them these lectures, they go like, हाँ हाँ पता है हमें खाना चाहिए अच्छा healthy ये वो blah blah. But
I guess that's it for today. It's really nice talking to you, and मुझे लगता है कि जितने भी myths और जितनी भी चीजें लोगों को लगती है कि ये होना चाहिए, हम कुछ भी यूज कर लेते हैं, बहुत सारी चीजें like आज के podcast में you educated our viewers, our audience to an extent. Thank you so much for being with us. Thank you so much for giving your time. At least give me, obviously. I've been seeing you, and that's a lot.
Thank you so much, Sakshi. It was absolutely it was amazing being here and sharing my insights on this particular subject. I really I feel for it, and I feel this is me. It's my passion. It's my work.
Should go beyond.
Yes, it should go beyond, and I love educating people about it. So I hope I've done some justice to it. So thank you so much for the opportunity.
Thank you. That's very sweet and kind. Thank you.
Thank you.